Your body is good at healing. Most of the time, when something goes wrong, it quietly repairs itself. But sometimes, when there is a pocket of infected fluid or pus, or a collection that is built up in the wrong place, the body gets stuck. The immune system surrounds it. Antibiotics reach toward it, but nothing can clear it from the inside. That is when your care team recommends a percutaneous drain. The word percutaneous simply means through the skin. A percutaneous drain is a small, soft tube placed through your skin into that collection, guided by live imaging so the physician can see exactly where they are going. This video will answer the question we hear most. What exactly are you going to do to my body? What will I feel? And what happens afterward? We will use 3 words to tell that whole story. What enters, what leaves, what stays. Let's start with what is actually inside. When your body fights an infection, white blood cells rush to the site. The battle produces a walled-off pocket, filled with fluid, bacteria, and the debris of that fight. We call that an abscess. Other fluid collections can form too, after surgery, from a blocked duct like a bile duct, or from a burst cyst. The names change. The problem is the same. A pocket of fluid is trapped somewhere it should not be. Antibiotics can help with the infection in the surrounding tissue, but inside that walled-off pocket, they struggle to get in. The collection needs to be physically removed, and that is exactly what a percutaneous drain does. Now, what enters? Your interventional radiologist, the physician doing this procedure, begins by looking at your imaging. They map the collection, its size, its shape, and most importantly, the safest path to reach it. Safe means avoiding bowel, blood vessels, nerves, other organs. This path is planned down to the millimeter. When the plan is set, the procedure begins. The skin at the entry site is cleaned and numbed. Then, a thin needle, smaller than you might imagine, travels along that planned path, through the skin, through soft tissue, directly into the collection. The physician confirms the needle is in the right place. Then, a thin guide wire is passed through the needle. The needle comes out, the wire stays. Over the wire, a soft, flexible drainage catheter is guided in. The wire is removed. And at the tip of that catheter, something clever happens. The tip of the catheter is designed to curl. It forms what is called a pigtail, a small coil that sits inside the collection. This is not an accident. This is the design. That curl is what keeps the catheter from slipping back out through the tissue. It anchors the drain in exactly the right place, inside the fluid, so it can do its job. At the skin, a small suture or a securement device holds the tube against your body. 2 anchors, inside and outside, working together. Now, what leaves? Through the catheter, the infected fluid begins to drain. It travels from inside the collection, along the tube, and into an external drainage bag connected to the outside of the catheter. In the beginning, the fluid might look murky or discolored. That is the infection leaving your body. That is the drain doing its job. Over time, as the infection clears and healing begins, the output will become clearer. Your care team will monitor the output at every step. Here is something worth understanding. Draining the collection does not instantly end the infection. The surrounding tissue still needs time and antibiotics to heal. But by removing the pool of infected fluid, you are doing 2 things at once: relieving the pressure and the pain that comes with it, and giving your antibiotics a better chance to work. The drain and the antibiotics are a team. Let's talk about what you will feel. Before the procedure starts, local anesthetic is injected at the entry site. This numbs the skin and the tissue underneath, similar to what a dentist uses. You will also receive IV sedation, medication given through your IV line to help you feel calm and drowsy. Most patients describe the procedure as feeling pressure, maybe some fullness, but not sharp pain. The procedure team monitors your heart rate, blood pressure, and oxygen the entire time. You are never alone on that table. Afterward, the entry site will feel sore. That is normal. Your team will manage that soreness with appropriate pain relief. And now, what stays? The catheter stays. The bag stays. Together, They are your working drain. We know this part can feel strange at first. Something is outside your body. It is visible. It is attached. Here is the way to think about it. That bag is proof the drain is working. Every milliliter in that bag is infected fluid that is no longer inside you. The bag is small and discreet. Most patients carry it clipped under clothing, in a small pouch, or in a mesh holster. You can walk, you can sit, you can rest at home. Your care team will tell you specifically what you can and cannot do, including whether you can shower and how to protect the entry site when you do. One of the most common worries is this: what if it falls out? That concern makes complete sense. Here is the honest answer. The pigtail coil inside the collection is one anchor. The securement device at your skin is another. Together, they are designed to keep the drain stable through normal daily movement. The important rules are simple. Do not pull or tug the tubing. Be careful not to catch it on clothing or furniture. Keep the site clean as your team instructs. If the drain ever does seem to move, slip, or come out, contact your care team right away. Do not try to reinsert it yourself. Living with a drain takes a little daily attention, and your team will walk you through every step. Output: empty and record the drainage bag as your team instructs. Volume, color, and consistency all give your team useful information. Suddenly, much less drainage, or a sudden change in color or smell is worth reporting. Flushing. Some drains need a small flush of saline to keep the tube open. If yours does, your nurse will teach you exactly how to do it safely. Site care. Keep the skin around the entry site clean and dry. Change the dressing as instructed. Report any redness, warmth, or discharge around the site. None of this is complicated, and you will not be doing it alone. Your team will give you written instructions to take home and a number to call if you have questions. There are certain signs that mean, call your team today, do not wait. Fever. A temperature higher than your team's threshold is a sign the infection may need attention. Increasing pain. Some soreness at the site is expected. Pain that is getting worse, especially deep pain, should be reported. The drain stops working. If the bag is not collecting fluid, and you would normally expect it to be, the drain may be blocked or displaced. The drain falls out or moves significantly. Contact your team before doing anything else. Leaking around the tube. Fluid seeping around the outside of the tube at the skin is a sign the drain may need adjustment. Write these down. Put the care team's phone number somewhere you can find it easily. These calls are not a bother. They are exactly what the team is there for. Here is the part that matters most to most patients. When does this end? Your care team will schedule follow-up imaging while the drain is in place to check whether the collection is resolving. When imaging shows the collection has cleared, it is time. Drain removal is not surgery. It takes only a moment. The physician releases the internal coil, the securement at the skin is undone, and the catheter slides out. A small bandage covers the exit site, and you go home. The timeline is different for every patient. It depends on the size of the collection, how quickly it responds to treatment, and your overall health. Your team will give you the most accurate picture for your specific situation. Let's bring it all together. What enters? A needle. Then a soft catheter, guided by live CT or ultrasound, placed precisely into the fluid collection. What leaves? The infected fluid, the pus, the pressure. Out through the catheter, into the bag. Your body begins to decompress. Your antibiotics begin to reach where they need to go. What stays? A soft, secured drainage catheter with a pigtail coil inside and a securement device at the skin. A small external bag. Both are temporary. Both are doing a job. And when that job is done, they come out. A percutaneous drain is not a sign that something went wrong. It is a precision tool designed to remove what your body cannot clear alone and give you the best possible path to recovery. If you have questions, write them down. Ask your care team. That is exactly what they are there for.